Angela over at Urban Core Pilates and Fitness, and this is one of our instructors, Lisa Slattery. Today we're going to show you 3 exercises you can do for getting rid of neck and shoulder pain. Obviously, neck and shoulder pain is very prevalent in our society. A lot of people have it because we're very sedentary, we sit a lot, and we don't move our shoulder girdle that much. So we're going to break down like the different types of joints that are in the shoulder girdle, and we're going to show you a few different exercises you can do so that you can create mobility in those joints and be pain-free. The shoulder joint is very complex. It actually has 4 different joints, and we define a joint as where 2 bones meet, and it's usually lined by cartilage, and it allows the body to move. You have hundreds of joints all over your body. Now, in the shoulder girdle, the first joint we're going to talk about is the glenohumeral joint. So this is the arm joint. So when you lift your arm up and down here like this, that's considered a joint. So for a lot of people, this joint gets stuck in the forward position. So the arm bone rolls forward, and the chest becomes very tight, and then this pulls on the neck. So we're going to address moving that joint. The second joint we're going to talk about is the scapulothoracic joint, and that's where your shoulder blade is. So that little winged thing that's here, that's your shoulder blade. So where the shoulder blade sits on the rib cage, that's called the scapulothoracic joint. So we're going to talk about creating mobility in that joint as well, because you need to create mobility in both. The third joint or series of joints we're going to talk about is the thoracic spine right here. So that's the part of the spine in between the shoulder blades. So for a lot of people, they get rounded forward like that, and that creates obviously a lot of tension and strain in the shoulder girdle and neck and head because there's no motion happening here. So we're going to talk about mobilizing that as well. So the first exercise we're going to do is we're going to do some thoracic extension. So I'm going to have Lisa lay down on her stomach. All right. So she's going to bring her arms up over her head like so and create like a little triangle with her hands. And her elbows are wide out to the sides of the room. What she's going to do is she's going to push into her elbows on an inhale and then start to lift her thoracic spine. She's imagining her breastbone glide forward. You see how she's getting just mobility right in through here. It's not in the low back at all. So just mobility right in through here. And then she's really going to reach the crown of her head up and forwards to create that length in the thoracic spine so that you're creating nice length and mobility here. She's just going to hold it isometrically, take some deep breaths, and continue breathing into here to open up all the connective tissue there. So creating length and space and mobility in that thoracic spine. And then she's going to slowly lower back down. So we'll do that one more time. So she's going to exhale, let all the air out, push into the elbows. On an inhale, she's going to lift that thoracic spine, reaching the breastbone up and forward, and then lengthening through the cervical spine and all the way through the crown of the head. She's going to take some deep breaths into the sides and the backs of the lungs, keeping that open. And she's really going to reach out through her. Yeah, there you go. That's it. Good. And then she's going to lower all the way back down. Okay? So we're starting and opening up the thoracic spine first because that's closest to your center of gravity, and then we're going to go outward with the shoulder joint. So the next thing we're going to do is we're going to talk about moving the shoulder blades on the back. So the shoulder blades move wide on the back. They can protract and then they can retract. You squeeze them together. Now, we never do this motion because we never really have to. We're sitting, you know, for long periods of time, even standing. The only thing we do to move the shoulder blades is reach up overhead, and we don't do that incredibly often. So I'm going to have Lisa come into a quadruped position, which is an all-fours position. And then she's going to start with a neutral back, so just like a flat back. Okay, and then she's going to pull her shoulder blades wide apart from one another. Yep, there you go. And then she's going to lift up through the breastbone. So she's going to create all this length and space here. Then she's going to come down and she's going to come into extension, and then she's going to bring those shoulder blades together, bringing the spine of the scapula together, which is the top aspect of the scapula. Good, and then she's going to round it, drop the head. Good. Pushing away, and then she's going to bring the shoulder blades all the way together. Nice job. Does that feel good?
Yes.
Okay, so that's working that second joint we talked about, the scapulothoracic joint. The third thing we're going to do is to open up the glenohumeral joint, right? So as I talked about before, it gets stuck in the forward position, so we're going to create range of motion in that socket so that the joint can articulate in every direction that is possible. So you're going to do, for this one, you're going to have the person lay on their side, or you're going to do that yourself, and then you're going to grab a weight. So you could do like a 1 pound weight, which would be a soup can, or you could do a 2 pound weight or a 3 pound weight. Depends on how much stretch you feel like you want for this one. Is a 3 pound weight okay? Sure. Okay. So I'm going to come from behind here and show you. So what we're going to do is we're going to keep the shoulder blade on the back, and then she's going to slowly reach the arm up over the head, getting motion at that joint, and then she's going to reach back, stretching the pec, and then she's going to come around. So what we're doing here is we're allowing that arm bone to move in every direction that movement is possible, so it gets kind of unstuck in the front. We're stretching out the pec, and we're keeping the shoulder blade still on the back as we do that. How's that feel?
Opening.
What?
Opening.
It feels opening. She's opening. Good. And then we're going to go ahead and do the other direction as well. I'm going to get out of your way. It's okay. She's going to open back out. And then she's going to reach, and you're going to notice that she's rolling her spine backwards, opening up the pec, and then she's reaching the arm up over the head. Obviously, we didn't do the other side, but we would in real life. So how does that feel, Lisa, in the upper body?
I feel more with my shoulders back, and that I'm more with my head on top of my shoulders.
Good. Yeah, exactly. So she feels like more openness here, and she feels her head back up on top of her spine instead of being rounded forward. So most of us could use this. So feel free to do these exercises at home, at your leisure. So thanks for tuning in. Knowledge is power. Visit us on the web at urbancorechicago.com.